Do you feel confident in assessing and treating pelvic floor muscle overactivity? Let's talk about it. First off, if you're new here, hi, I'm Dr. Brenda Heineke, and I'm a pelvic floor physical therapist and prenatal expert. Make sure that you subscribe and like this video. All right, pelvic floor muscle overactivity, it has a lot of different names, especially in the research and the literature. From tightness, hypertonic, overactive. Let's clear it up first and then talk a little bit about what it is and how to assess it and why it's important. So when the muscles are overactive, which really is the best terminology to use because it's that the muscles are just in a more contracted state, but they can still lengthen. It's like a functional tightening or a functional shortening of the muscle. So hypertonicity implies a more neurological component of it, or that it's stuck in a contracted state because of a neurological component, whereas overactive is that the muscle just has a more difficult time getting that lengthening component. So proper function of the pelvic floor, it needs to be able to contract and relax completely and lengthen, especially for childbirth, which is why we're talking about this. So, do you know how to properly assess for it? And I'll be honest, I don't have a great answer for you. A lot of our courses will tell us that we should be using a biofeedback machine and looking at how they can contract, what levels on the biofeedback are they getting to assess for overactivity. However, it's not the most effective way. And I think the best way to assess is using your sense of touch and your expertise. So when you are doing an internal assessment, you should feel that muscle contract and relax. If that relaxation is delayed or it takes a lot longer for it, or they aren't fully getting back to that baseline level, that's overactivity. You also might run into, they can contract and relax, but it's very minimal because it's already overactive and it's already partially contracted. So your force generation is much less when the muscle's already shortened. So you might have someone that you're grading as a lower number on the muscle grading scale, a 2 or 3. And really it just is that they can't get the full excursion of the muscle. So this is where your sense of touch really comes into play. You want to be able to see what that muscle feels like. Over the years, we've all felt tight muscles over the other parts of the body. So you know that it has a more dense, more rigid feeling to it. Sometimes it might even feel kind of like boggy, especially if they have more inflammation or congestion. So you want to get a sense of what that muscle is doing. Same as if the muscle is really atrophied. You don't get muscle bulk. It just doesn't have a whole lot of fullness to it. Would be a good example of atrophy. Different topic, I know. But you really want to develop that sense of touch, because that's what you really need to rely on. It's so difficult to just use muscle grading scales or biofeedback or anything else to really truly get a full assessment. If they have pain, that also is going to indicate to you that it is overactive. Any kind of pain, those muscles are definitely in that inflamed overactive state. So I hope that helps just assess a little bit. And then why is it important? Especially during childbirth and for delivery, but at any time too, really, we want the muscle to be able to do that full excursion. So lift and lower. During childbirth, those muscles need to be able to stretch and lengthen and expand. And so if it's overactive and it can't lengthen fully and it can't fully relax well, it's going to be a lot more difficult during childbirth. So we'll talk about that more on another video. But make sure that you like and share this video with any other pelvic floor PTs that you know.